Hello, this is Dr. Steele. Today I want to talk to you about mental health and diabetes. As you know, diabetes not only affects your vessels, which is the primary site of damage. As you know, and as you remember, diabetes is a vascular disease. If the food is not going where it needs to go, it lingers longer in your vessels, and it can, through time, block those vessels. But as well as remember that diabetes also is affecting the glucose, the energy from going inside those cells because it's staying in our vessels, but it's not going inside the sugars in a timely manner inside those cells. So if not going inside those cells, it's affecting how we feel, especially how we feel as far as energy. And not to get too technical, but ATP, how the cells are moving not only the nutrients, but also the electrolytes and so on and so forth that can affect it. And remember, the nervous system creates electricity, and that electricity is altered when you have abnormal sugar levels or the sugar is not entering the cells as they should, and that's creating problems. Therefore, people feel depressed, and that's one of the most common symptoms. They feel not only extreme fatigue if their sugars are uncontrolled, but they don't feel like doing much. And it's like a revolving door. You don't feel like doing much, you're not moving, you're just eating, but you're not moving. By not moving, you're not burning those calories, you're gaining weight. I'm talking about type 2 diabetics. So it's important to recognize that because in order for us to feel more energetic, less sadness, we need to control our blood sugars. We need to find someone that can help us, a provider or a doctor, control those levels. And as you know, as we get older, we need more help. I mean, I wish I didn't have any more gray hair, right? I wish I had gray hair, but as we get older, we lost those cells that produce that color, as well as we lose cells that produce certain, to simplify, internal juices, as well as structural things in our cells that gives rise to, in this case, diabetes. And by default, if it's not controlled, most patients feel sad, depressed. They don't want to do much. And I'm saying this because we need to understand that, because sometimes family members don't understand why the patient is behaving in a certain way. And also there's another caveat. When people are not controlled, the patient, sometimes he gets really aggravated or angry really fast. Because just imagine that you haven't eaten. Even though the patient is eating, he feels that, if he or she feels that they haven't eaten. So they feel that, especially because they feel hungry, but it's not enough because the food is not going where it needs to go. So that's my talk for today. Be nice to your family members that have diabetes. Understand them. Understand where they're coming from. You will never understand until you are on their shoes, until you're them, how they feel. So we need to be more empathic, more understanding. That's my talk for today. I'm Dr. Richard Steele. Talk to you soon.